Hi, my name's midwife Natalie and I'm here to talk to you in this video about releasing the waters and stimulating contractions. I'm going to discuss 3 ways in which you can stimulate contractions. One way is to release the waters that surround the baby. Another form of stimulating contractions is by the natural oxytocin produced by pregnant people when they are in spontaneous labour. For those that need help with contractions, we can give an infusion of a synthetic form of oxytocin called syntocinon. Releasing the waters around the baby is often referred to as an ARM. This means artificial rupture of the membranes. Sometimes it might also be called amniotomy. What that means is the fluid is released by the midwife inserting 2 fingers into the vagina and using a tool called an amni hook. When the waters are released, they bathe the cervix. This helps to produce or release prostaglandin, which helps to soften the cervix. It also enables the baby's head, if that's what's presenting first, to drop down onto the cervix. This applies pressure to the cervix, which can also help it to soften and open. ARM may be offered as a first form of induction if you have a Bishop score of 6 or more, or it may be done once the cervix is open enough using other forms of induction. ARM might not be offered in some situations, for example, some infections, if the baby's head is very high in the pelvis. But your caregivers on the day will discuss these options with you, with risk and benefits, and you can make a group decision. Before the waters are released using an ARM, your caregiver will ask to do an antenatal assessment to confirm you and the baby are well. This will include a CTG to monitor your baby's heart rate. An ARM is usually performed on our delivery suite. In some cases, it may be possible to do this on our midwife-led unit, but your caregivers will need to discuss that based on your individual circumstances on the day, and only in cases where there are no other concerns for mum or baby. Once you've discussed the risks and benefits, and you've given your consent to proceed with the ARM, your midwife or doctor will wash their hands, apply gloves, and ask you to lie down comfortably on a bed. We will ask you to put your ankles together and your knees apart, and to use your breathing that both midwife Caroline and midwife Claire have discussed for vaginal examinations. When you're ready, the midwife or doctor will insert 2 fingers into the vagina. They will then slowly guide the amni hook into the vagina, taking care to make it as comfortable for you as possible. Once they've confirmed that they can feel the bag of waters, they will then apply the amni hook to release the waters. After which they will ask to put a CTG machine on to monitor the baby's heart rate for another 30 minutes. If all is well and the fluid is clear, that can be stopped, or it may need to stay on a little bit longer depending on your circumstances. Once your waters have released, they will continue to trickle out from the vagina. This can feel a little bit unusual sometimes, and you will need to wear pads to catch that fluid, but so we can also monitor the colour and the amount of fluid that's coming out. This will continue for the rest of your labour until the baby is birthed. We will encourage you to mobilise by being upright, forward leaning open, moving around your environment. That will help the baby's head to drop down onto the cervix and enable that fluid to drain away. By mobilising, that will hopefully increase your chances of contractions starting. When you're tired, take the opportunity to take small rests and make sure that you're pacing yourself. It's important to monitor the colour of the fluid that is draining from the vagina. We expect it to be clear, similar to what a white wine would look like, clear with a slight yellow tone to it. If the fluid changes colour at any point while you're in the hospital with us, or if you're at home, please contact a midwife and inform them. If the fluid looks like a rosé or a rosé blush, that could be indicative of a light bleed. If there is anything that looks like a red wine, this is a heavy bleed and needs urgent treatment. If you're at home, please call 999. If you're in the hospital, please use your emergency buzzer. The staff will inform you where that is when you arrive. If the fluid looks brown or green or has any bits in it, this could be a sign that the baby has done a poo inside. This might not mean anything serious for the baby, but it could be a sign that the baby is experiencing stress. In this situation, we're going to ask to monitor the baby more closely, and we're going to ask you to remain within the hospital. The staff will talk to you about the situation at the time and if there are any concerns. If your contractions start spontaneously, then your midwife or doctor will suggest another vaginal examination to assess the Bishop's score. It's usually done 4 hours after the waters are released. If after 2 hours there are no contractions, then we're going to ask to perform that check again. Sometimes you might get contractions, but they're not necessarily doing the work on the cervix. So your midwife or doctor might suggest an examination even in the presence of contractions. If you've just had an ARM to release the waters as your method of induction, it may be possible for you to use the pool room on our obstetric or consultant-led delivery suite. Please talk to the staff on the day regarding your options for this. So for those people that have contractions but they're not making any change to the cervix, or for those people that have had an ARM and the contractions haven't started spontaneously, the next step would be to offer syntocinon. This is a synthetic form of oxytocin and it's given by a drip, usually in the back of the hand. We would only give this with your consent. It's absolutely possible for you to consider to have an ARM and then reconsider whether you want to go on to the next stage of syntocinon. But please be aware, the Royal College of Obstetricians and Gynecologists point out that if you delay the next stage, or if you decide not to take that step, this could make labour longer and could possibly increase the likelihood of infection. Something to bear in mind about syntocinon is that it's a synthetic form of oxytocin. If you've attended any of our other classes or done any reading, you'll have found out that oxytocin is a fantastic hormone for labour. It really helps with feelings of euphoria and helping the labour to progress. Unfortunately, the artificial form of oxytocin, syntocinon, doesn't give you these natural benefits. Whilst it stimulates contractions, it doesn't support the body to release endorphins. That means for some people, this type of labour can be very intense. You also may not get a gradual build-up of contractions like you would for a spontaneous birth. Therefore, you may wish to consider your pain relief options before the syntocinon is commenced. Some people will choose to see how they go, others will opt to have an epidural before the infusion is commenced. Syntocinon needs to be prescribed by a doctor. The midwife will ask a senior registrar or a consultant to come and meet with you to discuss the options and create the prescription if required. Usually, we'll have performed a CTG to monitor your baby's heart rate 30 minutes prior to that, so that can inform their decision making. Once they've discussed the risks, benefits, disadvantages and advantages for you, and you've given consent to start the procedure, a drip will be inserted and an infusion will be set up of the syntocinon. Syntocinon starts at a very small dose and is gradually increased depending on what's happening. If contractions start and become regular, then the syntocinon drip can be stopped or reduced depending on the circumstances. Your midwife will oversee this and liaise with your doctor. Once you're on a syntocinon drip, the expectation is that you would have one-to-one care. We would also recommend continuous CTG monitoring of your baby's heart rate so that the midwife can observe the contractions and their frequency, as CTGs have an option to measure those too. And we can also assess and observe the baby's heart rate and how they're reacting to the drug that you're being given. Once the syntocinon is started, you would be cared for on delivery suite, our obstetric-led unit. The midwife will continue to assess for signs of progress and they will ask to perform regular vaginal examinations to see what changes have occurred. The first vaginal examination will be offered usually 6 hours after syntocinon has been started. Or if there are regular effective contractions, this may be done sooner, for example 4 hours. In some situations, midwives or doctors will ask to perform additional vaginal examinations based on what's happening at the time. As I've said, having syntocinon infusion can be quite intense and the contractions can build up very quickly. Therefore, it's really important to consider your pain relief options. At the Royal Surrey, we're here to support you in your choices. It's important to tell us what you need when you need it so that we can do the best for you. The options available to you are to use TENS machine, gas and air, also known as Entonox. You can also use pethidine in some situations, and we have epidurals here too. You may also want to consider other coping strategies, for example hypnobirthing, relaxation, movement, distraction, massage, and having the support from your birth partners. Once you're on delivery suite in labour, you can have 2 birth partners with you. You will have your own room with an ensuite bathroom. And we have a range of equipment that you can use to help to support in your comfort and moving around. We have beds that can adapt to various different positions to support you. Your midwives can help you with that. We also have a video available via our maternity Facebook page where you can see the capability of the beds. Remember to use the 5 R's that Midwife Claire discussed. These are really useful for labour and may support in your comfort and feelings of control. Thank you for watching this series of videos. At the Royal Surrey, we really care about your experience and we hope that this has helped. Please refer to the other resources available in this digital pack. You can also discuss your individual circumstances with your named midwife or the midwife or doctor caring for you on the day. Please be aware that this video does not replace individualised discussions about your own circumstances. It's just meant as a guide. We really do wish you a fantastic experience and we look forward to welcoming you into the Royal Surrey.